introduce Michelle, who's going to introduce the team. I think you don't know everybody, but come on out.
Thank you. Good morning, everybody. We're going to share a little skit with you to emphasize the definition and the appropriate use of chemical restraints, because we have listened to you and we know that in the clinical setting, sometimes restraints can be complex, particularly when you're making a call between, is this a chemical restraint, is this not a chemical restraint? So this is an interactive skit, okay? So we're going to be asking you to raise your hand to identify if the scenario is a chemical restraint or is not a chemical restraint. So if you are correct, if you provide the correct answer when you are asked, you're going to hear this. If your answer is incorrect, you're going to hear this. So our timeline is kind of tight, so we won't have a lot of time for questions and discussion, but this is a very important topic. So if you do have questions, you want to talk about it further, we know there's some great area with chemical restraints, please contact any one of your clinical educators, myself, Zoe, and we'd be happy to discuss the particular scenario with you. Okay, so scenario one. Scenario one.
Miss Liz, I'm going to go ahead and play some music therapy for you. Do you think it's helping?
No! I haven't slept for 3 days.
3 days? I'm so sorry. But this is supposed to help you in that squishy ball as well.
It helps me get really angry and I want to hit you. Oh!
Miss Smith is really getting anxious. She almost hit me. What am I going to do? I've already tried the squishy ball. And I've already tried the music therapy. But it's not helping. Maybe I should call the doctor. Dr. Duguid? Hi. Yeah, Miss Smith has a history of acute MI. She doesn't have any underlying medical conditions that could cause her agitation and anxiety. What can I give her to calm her down and make her lay down in bed quietly? Ativan 1 milligram orally now? I like that. Thank you. I can actually see Zoe's face. I need your help. Do you think this is not a chemical restraint? How many of you think it's not a chemical restraint? How many of you think it's a chemical restraint?
This is a chemical restraint. And why is it a chemical restraint? It limits the patient movement, right? The intent is to control their behavior, and it's not associated with their clinical treatment. Okay, scenario 2.
Hello, Miss Jones. How are you doing this morning?
I'm a little anxious. I'll make it. A little irritated.
Is there anything I can help you with?
I don't know! Get me out of here!
Miss Jones is getting really anxious. She almost hit me. Well, she did hit me. What am I going to do? Good thing I actually completed a nonviolent crisis intervention initially and every year. But it didn't really help me out. Maybe I can check her chart. Oh, look at this. The physician has actually ordered as-needed Ativan to control her agitation. This will enable Mrs. Jones to function and attend her therapy. I like that. But then again, with her detox symptoms, I don't know. Again, I see Zoe's face. How many of you think this is a chemical restraint? Nobody? do you think this is not a chemical restraint?
Okay, this is not a chemical restraint because it is standard treatment for this patient's detox clinical plan.